One of your basic jobs as a nurse is to be putting in IVs. What you're going to do is get the saline out. What you're going to do is you're going to be prepping your HEP lock. You start it out as a HEP lock and you can turn it into an IV. Okay? And whenever you put an IV in, you're going to be doing it with longer tubing. Everything has to be flushed. You don't want any air because an air will cause an embolus. And you don't need air bubbles in your bloodstream. These are the different things that you're going to be using. You're going to be using a tourniquet on the arm. You're going to be cleaning it. We now don't do alcohol and betadine, but we do something called ChloraPrep. We'll be cleaning the site with ChloraPrep. And then you're going to get your tape ready. You always want to be prepared before you put the IV in. That way you're spending the least amount of time getting ready. That way you can just do boom, boom, boom when you're with your patient. First, you introduce yourselves. Hi, my name's Meilani. I'm going to be putting an IV in you for hydration. Okay. This is going to be a little bit tight. You always explain everything you're going to do. So this is going to be a little bit tight. And then just relax your arm. And then what I do first is, while I'm just looking before I stick, I'm just going to use alcohol. And when I find what I need, I'll use the ChloraPrep. So you always want to start lower first. So if you miss, you still have more to go. And then last resort is the anticube. So you just want to bend. Just loosen up your hand. Now, if it's hard to find a vein, we have something called a vein finder. It's a new technology. It's so new I can't even use it. There you go. And what it does is it'll actually find your veins. See? Right there. Okay, you ready?
Ready.
So just based on visual?
Okay, so
Here, you want me to hold more for you?
Yep, right like that. And then I'm going to go with this one.
Okay.
You feel a stick?
Yeah, we're good.
So what's the point? The vein cools the skin compared to the surrounding skin, so that
helps
red
you
goes
find
to
the veins, so you can start an IV.
I understand, but why? How does it help you find the veins? I'm assuming that the vein's existence cools the skin to less than the normal
There, and it's in.
skin.
All right.
So that you know where it is.
Not sure how exactly it works, but it's just infrared.
And then I'll tape it in. Okay, and then you can, we're done.
Instructions on it.
There.
All right, and now.
It looks dark there.